This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this new week on Monday, March 31st. Thanks for joining us. I'm Kyle Wiggs, and in with us is a monthly visit to the studio, Dr. Brian Huggins, health officer for the Monongalia County Health Department. Good morning.
Good morning, Kyle. How are you today?
I'm doing well. Thanks for coming in. We appreciate it. Okay, so what we're going to talk about today is a subject that many people are discussing, and it is this measles situation, which has not yet affected West Virginia.
That's right. We've been getting a ton of calls, though, at the health department. So people wondering, what's my risk? Do I need to get another shot? How do I check? It's on everybody's mind right now, especially what's happening in Texas.
There are 13 states that have had reported measles cases. The highest profile situation in Texas with, last I saw, was over 200.
Yeah, I think they just hit 400 cases.
Okay,
so they've doubled that now.
Yeah, and it's come as close in terms of bordering states. It's come as close as Ohio. Why hasn't it affected West Virginia yet? We'll get into that. But let's take a step back and talk about what measles is.
Yep. So measles, going back to the basics, measles is a virus, right? And it's spread through respiratory droplets. So it is a respiratory disease, even though everyone thinks of it as a skin disease because it causes a rash, but it's actually just like flu, RSV. It is a respiratory disease. The thing about measles that is really bad is that it is the most infectious of the respiratory diseases, meaning that for every person that catches it, you can expect, and the data is a little bit, wide, but it's anywhere between 9 and 18 people are going to get sick from that virus, which is the highest of any of the viruses that we know. When you think about flu is like around 2 to 3. I think COVID is somewhere around 4 and 5, and we thought that was high.
Yeah.
Measles is the type of thing that I like to use a movie theater analogy. It's airborne. And so what that means is it can float in the air versus droplet. So flu is droplet, which means it hangs onto heavier water and it'll hit the ground. This actually can be suspended on a little droplet of water in the air for up to 2 hours. Wow. So if you go into a movie theater and someone has measles, that entire movie theater for the next 2 hours is possibly going to get measles.
Because it's floating through the air in that enclosed space.
And because it's airborne, it's going to be picked up by the vent and it's going to move around. It's not automatically going to hit the ground with gravity like a lot of droplet disease. And that's where you draw that line. We've heard like with different diseases, there's airborne. There's airborne means it will linger in the air. Mm-hmm. Now, its only place that you get it is in humans. So it's not in animals. You're not going to get your pets sick. But it means you have to get it from another person. And for almost 2 decades, we had no measles in the United States. So from like 1995 to 2015, there were no cases of measles. And it was actually from the World Health Organization, we were considered eradicated in our country.
So 0 cases in the entire country for 20 years.
Yes.
Okay. And again, let me take another step back. The coronavirus, COVID-19, caused a worldwide pandemic. You're saying this is twice as contagious.
Yes.
With the way you explained it moments ago. This is twice as contagious than COVID-19 was. Okay, so that's the measles. You explained it, how we catch them. What happens to you when you get them?
So when you get it, and I just want to take a moment from what you just said, because prior to the vaccine, and we'll get into that in a minute, prior to the vaccine, they were estimating in the United States, 2.6 million people were getting it a year. That's how contagious it was. And then the vaccine came out, and that's why you don't see the spread. But now to answer your other question about symptoms, right? So symptoms are about after you get exposed and the virus gets in your body, you actually won't start to see symptoms for a week to 2 weeks. So 7 to 14 days, which is also something to think about. And it usually starts with a high fever. So that's the first sign, which how many times do we get a fever and we don't even check? We don't check the temperature. And when I say high fever, it's going to be between 101 and up to like 105 degrees.
That's a dangerously high fever.
Exactly. A 99 fever, that's not what we're talking about here. We're talking about something over 101 degrees. Another symptom that most people will get, they get white spots in their mouth. Koplik spots is what those are called. And then 3 to 5 days after you start to have symptoms, so after that fever is when you're going to get that body-wide rash. It starts on your face, goes down the rest of your body. The really dangerous thing here is that people are contagious 4 days before the rash, up to 4 days after the rash. So that means, and I just said that the rash starts 3 to 5 days. It means you can be infectious a day before you even have a symptom, which is how it ends up back in the country. Is people travel, they get exposed, they don't realize they're sick, or they might just have a fever. If you're traveling, getting a fever of 90 degrees, sleep deprivation, whatever, right? So then you end up being contagious, and like I said, highly contagious disease. So you cough, you laugh. People don't even realize when you laugh, it's kind of gross to watch, but in the sunlight, you can see how much fluid leaves your mouth when you're laughing. Anyway, that's...
Okay. How dangerous is it? I mean, how sick do people get? Do people get hospitalized? Do they die?
So the answer is yes.
To all those?
Yes. It's mostly kids nowadays. It used to be kids and elderly, like most of your diseases, immunocompromised or at risk. But in a population that isn't vaccinated, you're going to basically get 1 in 5 people, about 20%. Right now, the rate with the ones in the United States is about 17 or 18%, are going to end up in the hospital. And you have the potential of getting pneumonia or worse, encephalitis, which is a brain infection. And then 1 in 3 out of 1,000 people. So very rare still, but 1 in 3 out of 1,000 people will end up dying from it.
Okay, so we've seen that played out almost statistically exactly how you said it, because there's at least 2 deaths in Texas out of 400 people.
Yes.
And by your math, that would lead to about 60 of those 400 people roughly being hospitalized.
Yes. And that's a lot on a hospital system for 2 reasons. One, it takes up potentially ICU beds or children's. It's a children's hospital you're probably going to. But second, they have to isolate you in the hospital, which is very difficult to do for dozens of people. But essentially, it takes that hospital almost out of commission while it's working that measles.
Because of
how infectious it is.
Yep.
Okay. And there's a lot of kids in Children's Hospital that are immunocompromised because of cancer treatment or other things.
Okay. Wow, that's pretty incredible. Okay, you've got it. You've got measles, you're very sick, you're hospitalized, or maybe not. Maybe you're just at home and you're isolated. What kind of treatment is there?
So unfortunately, there's not a lot that we have. So there's no antiviral. It's basically just like if you have a cold or a flu, you're just going to do supportive treatment to try to make you feel better. There's been a lot of discussion about vitamin A treatment, and that's been all over the news. So what has been shown worldwide is that if you're vitamin A deficient, you have worse outcomes. So there are a lot of countries where people have malnutrition and they don't have enough vitamin A in their diet. So that actually, if you're deficient, it is worse outcomes. So there is a push that, especially in all severe cases, that you would give a little bit of vitamin A just to make sure. Because if you don't know someone's vitamin A level, in the United States, it's pretty rare that we're vitamin A deficient, but there's also very little harm in giving vitamin A other than maybe the cost.
Well, wait a minute. I'm hearing some stories, though, of vitamin A toxicity, right? Can you get too much?
Yes, you can. So as long as it's given by a provider in the right setting at the right dose, you're fine. I would not go to the store and suddenly take a bunch of vitamin A. All vitamins can be toxic in high enough levels. And so that's something that you have to be very careful of, is that even vitamin D. We always hear about, right? Oh, the sun in the wintertime, take your vitamin D. If you take too much vitamin D, it also can be toxic. So everything, even over the counter, you have to be very careful what you're doing.
Okay, so we're hearing reports in Texas specifically, I've heard this, where the parents of these unvaccinated children are providing vitamin A as an alternate treatment, but that is having ramifications. In some cases, they're getting too much vitamin A.
Yes, it's very important to talk to a provider. If you're going to self-treat, especially with over-the-counter, never give more than the recommended label, what it is there. If you're thinking about doing more, get a hold of a provider.
Okay. How do you know if you have this, if you have measles?
So it's a blood test. So the way that we confirm it, obviously the symptoms. If you have the fever and you have, so as a health department, that's our job, is to try to figure out who actually has the disease, who doesn't. We've had a few calls recently, even from providers, that they've got somebody that's suspicious. So the way that it's confirmed is by sending off the blood work. We look for antibodies in the blood. Unfortunately, that test can take up to a week to get the answer for. So we will base it off of symptoms. If you've got the fever, if you've got the white spots, if you've got the rash, and it seems like you're a case, we are likely going to ask you to quarantine yourself at home. That way you're not exposing anyone else. In West Virginia last year, we had a single case in Mon County. It was someone that was partially... Of measles, yes. Partially vaccinated, traveled overseas, picked up the disease overseas. That's what we're seeing right now, is most cases are because of travel, and it's coming back. You're catching it when you're under-vaccinated or unvaccinated. That person didn't realize. They went to an urgent care. They went to the hospital before anyone knew that it was measles. And that alone, and this was without going to restaurants. This was without going like fast food. Imagine going to McDonald's or something like that. This was just in those scenarios. It created 150 people that we had to call, monitor, be careful of, especially immunocompromised people. But none of those people got it. So we had one case that was
they were vaccinated.
Because of our high vaccination rates in West Virginia.
Okay, so that's the next question. Why are these outbreaks occurring? Not in West Virginia. Big one in Texas, 13 states. Why is this happening?
It's happening because we're seeing loosening of the vaccine requirements, but we're also seeing just more people that are choosing not to vaccinate their children. There's been a lot of information that's circulating about the safety of vaccines. And from all of the evidence, so measles, let me just go into that for a second. There is no known death associated directly from the measles vaccine. So there are some cases of febrile seizures that can occur, and the older the child is, the higher the risk of that. And we're talking very, very, very rare, less rare than any of the complications that you would get if you got the measles virus. And so, but there has not been a death directly associated to the vaccine. And that's been going through the news as well, that yes, it's possible to die from getting the vaccine. And every vaccine is different, but I'm specifically talking about the MMR vaccine. So with that information that's been circulating, because there is a lot of misinformation that goes out, that has, of course, caused more people to be hesitant about getting their kids vaccinated. I will say that in West Virginia, what's interesting is, I'm going to ask you a question. Do you know what the number one reason people don't want to vaccinate their child is?
Because there is, I don't know what else to call it other than a myth. There's a myth that goes around that vaccines cause autism.
And so, believe it or not, that is not the biggest reason.
Okay.
The biggest reason is because they don't want to deal with their child screaming. They don't want to. Yeah, I know you're laughing, but it's true. It's the number one reason is, so what we've seen in West Virginia is there is a gap between when kids are born and when they're 5 or 6 and entering kindergarten. And people play catch up because we have a law that says that you have to be vaccinated to go to school. There's a big gap in between 0 and 5, and it's not because the parents don't believe in the vaccine. It's because it's inconvenient. It's because they don't want their kid to cry. It's because they don't want their child to say, I hate you, mommy and daddy, because you made me get a shot, right? So that having that law there actually helps us maintain that, or helps keep people on track, because it's not that they don't want to give it; they just don't want to deal with it. Honestly, yeah.
Okay, that's stunning.
Yeah,
to me.
Yeah, I know, because we hear all about the reasons, the health things, but it's most of the people that aren't vaccinated or the children that aren't vaccinated. It deals more with just yes.
Okay, so you've provided some statistics here that vaccination rates are down around the country.
Yes.
You say Idaho's the lowest. There are only 80% of people in Idaho are vaccinated. 14 states are below 90%. West Virginia has the highest right now.
Yes.
West Virginia has the highest vaccination rate of anybody in the country.
Yes.
And my original question was, why aren't these outbreaks happening here? That's the reason.
That's the reason. So when you drop below 95% is the magic number for herd immunity. Herd immunity means you've got enough people in a group that if you introduce measles into it, just like our single case, it is probably not going to go anywhere because there's a high enough vaccination rate to stop the spread. When you drop below 95%, you lose that herd immunity. When you drop below 90%, that's when you start to see outbreaks. And most of the states that you're seeing outbreaks are ones that have dropped below that 90%. 14 states are below 90%.
Okay. And there's measles outbreaks in 14 states. Now, again, I don't know if that 100% correlates.
Not direct correlates, not direct.
But, statistics are statistics. Okay. Again, vaccination. What can you do to ensure the public and again, we are visiting with Dr. Brian Huggins, health officer for Monongalia County Health Department. What can you do right here, right now, to ensure people that the vaccine is safe and it works?
So the CDC keeps a log of everyone that has anything that develops with the vaccine. So if you ever get a vaccine and you have any kind of side effect that you want to report, bad outcome, and the really bad outcomes are actually almost always captured because people end up in the hospital. And when you end up in the hospital and you recently got a vaccine, the hospital is going to report that to the CDC. So we have really good information, and the measles vaccine has been around for many, many decades, right? Mm-hmm. So we've been monitoring it and watching what happens with that vaccine, with all the vaccines, polio vaccine, et cetera. COVID's the new one. It's the outlier. And I do want, yes, the COVID vaccine is new because it's a new type of vaccine. But I want to stress that all of the other childhood vaccines that we've given, MMR, polio, Tdap, tetanus, right? Those have been around for a very long time and have a very strong safety track record. There's always going to be a few people, and I'm talking one in maybe 100,000 that are going to have an outcome. And a lot of times it's related to another illness that you have. Mm-hmm. It's not usually someone who's, just healthy otherwise. Vaccines are very, very safe. The actual evidence that we've seen, you don't see that. And I know autism is the big question mark, and there are going to be people doing additional research. And what they found is there was one study that was done, and when you actually do research, the study design is huge. And if you're not looking, when they actually went back and tried to replicate the autism study, and when they actually looked into the study design, they found that it was flawed in the way that it was designed, and it actually did not hold up that there is a link. Now, there's going to be more scientists looking into it again, but the reason that we're seeing most likely an increase in autism is because of expanding the criteria for diagnosis. Any time that you capture more people, the numbers go up, right? Mm-hmm. And what we've done is we've realized that we had such a narrow focus on what autism was that mental health experts have said we actually need to expand that. You probably remember when Asperger's was a big conversation point and nobody had ever heard of it, right? And that is when, as mental health gets better, they realize we need to include more people, to treat more people, to give them better chances. And that is almost definitely what they believe to be the reason that you're seeing more cases of autism, is that we've created a spectrum and now it's easier to fall on the spectrum.
Right. Okay. This has gone very, very quickly. It's gone by very fast. We're down, believe it or not, we're down to about 2 minutes left here. The COVID vaccine was successful in keeping people from dying and getting very, very sick, but it got politicized do you see that? Again, we could do a whole show on this. We got about a minute and a half. But do you see that politicalization of the COVID vaccine affecting the vaccines down the line?
Oh, absolutely. It is. It is right now affecting it. So COVID vaccine, some of the conversation the CDC had, which it certainly was not perfect, but what you saw through the pandemic and with that has now caused more hesitancy, and you're seeing more laws. I mean, even in West Virginia, there's multiple bills. One of them just was defeated, but there's multiple bills to loosen our vaccine requirement.
Right. You're
seeing that nationwide, and that's because of a direct effect of the COVID-19 response. And it's concerning, obviously, for public health. Polio is the one that probably I'm going to briefly talk about polio, because polio is the disease that, for those of us that are old enough, we remember iron lungs.
Yeah.
We remember people that we saw that had short limbs.
People in wheelchairs.
It's very serious.
People with walkers.
FDR, right? President, right? That's the one that if it comes back, I think people will then be very sad that they let vaccination rates drop. I mean, obviously with measles, people are dying. There's still 100,000 people that die in the world every year from measles. But when polio comes back, and it will, that's going to be a bad day for the United States.
Again, we were talking before. I'm a child of the 70s. I started grade school very early in the 1970s, and I remember the nurses coming down the rows of desks in school with the polio vaccine on sugar cubes, handing them out to the students, and we would dutifully take them. I mean, there's no way that would ever happen today. Now, I don't know if I was a young child. I don't know if there was some parental consent there, if you had to sign a form or whatever, but I don't think so. Yeah. It was just for the public good, you take your polio vaccine.
Yeah. And I know we don't have a lot of time.
We're down to like 30 seconds.
30 seconds. But I want to talk about malaria just for a second, because with what you were saying about the way they got rid of malaria in the United States, because we used to have it, is they literally sprayed herbicide on people's farms without their permission, right? That wouldn't happen today. And if malaria comes back, just like polio, it'll be much harder to do those things.
Yeah, very good. Okay, well, great information. Again, I wish we had more time, but Dr. Huggins laid the whole measles out in terms of what's going on, our vaccination rate, and the fact that we probably need to we do need to keep it up in West Virginia. Good information. We appreciate your time.
Thank you.
Dr. Brian Huggins, Health Officer for Monongalia County Health Department. That is Mon Health Talk for this Monday on WHAR.